And as more and more people are getting jabbed, there's increased focus on those who aren't being. The Vaccines Minister, Nadhim Zahawi, said today that official figures show that vaccine hesitancy, so-called, has actually halved in recent weeks among Black and Asian communities. And there's going to be a summit meeting to try to scale up ideas. That means have a lot of ideas that have been successful in improving the take-up rate. I'm joined now by Dr. Zubaida Haque, who's a member of the Independent SAGE Group and former interim director of the Runnymede Trust, which is a race equality think tank, and Dr. Philippa Whitford, the SNP's Westminster spokesperson for health. And she's also chair of the all-party parliamentary group on vaccinations. A very good evening to you both. Well, let's start and get both your views on vaccine hesitancy. And let's start, first of all, with identifying it amongst the groupings and the geographical regions. What's your take on that, Dr. Haque?
Well, I think this is the thing that's concerning. It was fantastic that Nadhim Zahawi, the Minister of Vaccinations, was talking quite a lot about the sort of disparities between some of the ethnic groups and how we needed to do a lot more there, and we need to do it, not people on the ground, a lot more there about encouraging people to take up the vaccine, and that means addressing their fears and anxieties. I think what I was really concerned about, and what Independent SAGE have been saying from the outset, is that this isn't just an ethnic issue. This is also an issue for younger groups. We know younger groups are less likely to take the vaccine than older groups. We know that women are less likely to take the vaccine compared to men. But we also know there are huge regional variations, and in particular in London, where there are significantly lower uptakes compared to the rest of the country. And I think in that sense, I was quite disappointed that Nadhim Zahawi didn't address that. And I was disappointed that he didn't address the fact that in deprived areas, in lower socioeconomic areas, that vaccine uptake was also an issue there.
OK, I see you nodding along, Dr. Whitford. So it's not just amongst racial minorities and ethnic groupings. And as Dr. Haque touched on there, I mean, particularly amongst the young, it's almost inevitable, isn't it? As they feel less threatened by COVID-19, they're going to be less minded to take a vaccine.
Well, the World Health Organization described very much three components that drive vaccine uptake. And our APPG actually published a report on how to encourage uptake just last month. And the first one is complacency. So the older population have certainly not been complacent about COVID. It causes them real concerns. But that might indeed become an issue, particularly when we get into the 20-year-olds or the older teenagers. The other two parts are having confidence in the vaccine, so tackling misinformation and disinformation. And the last one, and actually in our inquiry, that's still dominated, was convenience. If you bring the vaccine to people with someone they trust, their local doctor, local figures, etc., you can actually overcome quite a lot of this. And it is about reaching into communities and asking what's stopping them, not making presumptions that it's about religion or culture, but just saying, what are the issues in your community? And then trying to solve them.
And Dr. Haque, in terms of nudging people, what about the Israeli example? Of course, a nation that's even more vaccinated than we are, and they brought in a green pass, which, yes, it did discriminate between those who were fully vaccinated and those that weren't, but it allowed you to enter things like bars and restaurants and crowded places. And pretty soon they saw that hesitancy begin to evaporate, so much so that they've got rid of the green pass.
That might work for some groups. I think what we need to understand is the reasons for why people are not taking up the vaccines are enormously varied. And we heard from Dr. Whitford some of those reasons around complacency, around confidence in the vaccine, around access. But actually what we need to understand is a lot of it is around legitimate anxieties and fears, and simply marginalising people, stigmatising people, pointing the finger, bullying them, giving them ultimatums, making it mandatory is not the answer to this problem. The answer to this problem is that the government, working with local authorities, local GPs, directors of public health, but very much working locally, try and address those anxieties and fears, try and understand why it is that people are more reluctant. It's not just to do with complacency. And I think in that sense, saying to people, look, we'll give you a vaccine passport, we'll make it easier for you, will address some of those concerns, but not all of those concerns.
Dr. Whitford, what are your fears if we don't continue with this vaccination programme as fast as we have? I mean, the latest survey wasn't it, that over 80% of adults have antibodies at this point. We need to get more, though, do we?
We certainly do. I mean, we see the cases beginning to surge from the Delta variant. It's much more infectious than the Kent one, which was more infectious again than the original. And the problem is if you go, oh, well, we're not really seeing so many hospital admissions, and thankfully we're not, is if you just let it rip, you actually run the risk of generating yet another variant and more mutations. And that then could lead you to a significantly vaccine-resistant variant. Now, the issue is that, you know, we do need to bring it to people, and we do need to tackle the kind of misinformation. There are people who are making millions of pounds on the internet by how they direct people to anti-vax sites. The government are trying to tackle all of these things, but you actually have to tackle all the different aspects of it. In Scotland, our care home staff were originally being targeted by very directed misinformation. And people like Jason Leach and our chief medical officer ran webinars, and then all of our staff were vaccinated at the same time as residents. So as well as making it convenient, you were actually having this solidarity of being vaccinated with your colleagues and the people you were looking after. So it's just multiple different approaches, and we need to keep going with that.
Just a quick couple of thoughts from you both. Lastly, then, on the Delta variant, the Delta Plus variant, of course, originated in India. And just clear this up for us, because people are pointing out that in India, of course, pretty much not vaccinated at all, 3% or something of the population. Cases have dropped 86% in the last 4 to 8 weeks. I mean, can it really be that transmissible if this is happening in a relatively unvaccinated population, Dr. Haque?
Well, first of all, we need to be careful with averages and national averages, and we need to be careful with some of the data that we've seen from India. You know, at the beginning, there was a lot of denial about the level of hospitalizations, the level of deaths. So I think we need to take that with a pinch of salt. Secondly, this isn't happening in a vacuum. There's been a concerted effort. We know that India were incredible at the beginning of this pandemic. They were better than a lot of countries in terms of managing this pandemic, but somehow that changed, if you like, direction, and the government took a different direction where they decided that they were going to loosen all restrictions, even though we were in the middle of a pandemic. Now, public health measures are absolutely critical. And we are at a stage right now, Dermot, where we are looking to July the 19th. And I'm not entirely convinced that the government still understand the message that end of restrictions doesn't mean the end of COVID protections. There is a subtle difference. And that difference is that while major restrictions can end, we are still very much in the presence of a very transmissible Delta variant that has led to 2.5 times more hospitalization, that is the dominant variant in this country, that has disrupted education, that is high in terms of infection rates among younger children and so on. We need to do something about that. So you still need public health measures, and it's a lesson that this government needs to learn from other countries. OK, I'm sorry, we're out of time. Great talking to you both, Dr. Haque, Dr. Whitford. Thank you very, very much indeed.